So I'm Dr. Hudson Garrett, and I'm sitting here with our two esteemed speakers from today's BioBridge Summit, Dr. Othman and Dr. Kelly Osborne. And we really wanted to just end today by talking about some of the core things that we walked away with today. I know that we had several different audience members from infectious diseases, high-level disinfection, gastroenterology. We had some risk management players, as well as some other individuals from across healthcare, which was great from especially the greater Houston area. And we especially appreciate you taking the time out of your clinical schedule to join us today. But love to hear from your perspective, Dr. Othman. What was the biggest thing that you walked away with that you're going to immediately do tomorrow?
So I'm going to our endoscopy cleaning room and making sure that all the stuff we talked about today is implemented in my unit. It was a great opportunity for me. I learned a lot. It was amazing to be with all this expert talking about infection control and role of disposable devices in preventing infection. And it was thought-provoking. I actually came up with a lot of research ideas out of this meeting today. Listening to your talk too was eye-opening to me about the responsibility that each one of us have to be doing to prevent infection in the healthcare setting. And I was amazed by Dr. Osborne talk about training the staff, and I wish I would have that level of rigorousness and training in my program, which I'm glad that to hear about this today and to incorporate more of that in my unit and in general for the healthcare industry, in particular gastroenterology.
So it sounds like you have a busy day planned for tomorrow with some takeaways. Dr. Osborne, what about from you? What about, you've got some great learnings at your institution where you worked at a large academic health center. You rolled this education out. You brought different stakeholders together. But coming to a meeting like this, what's different for you? What are you walking away with tomorrow?
I think that there's a lot more opportunity to help and support other practices and healthcare institutions and work with societies to help develop toolkits and competencies and really outline those processes for everyone so that they can follow a standardized recipe for success and to ensure patient safety.
You know what's unique when I look at who's sitting around this table? We have a clinical nurse specialist in a gastroenterology division. We have a practicing gastroenterologist, and we have an infectious disease person. This is a pretty rare team, right? And sitting here in this type of meeting, which we greatly appreciate the Danish consulate for hosting us.
Yes.
Because it's a rare opportunity to bring all of the stakeholders together to talk about this very complex problem, which is patient safety related to reusable medical devices. Thinking about that, you mentioned the word competency. And all of healthcare right now is struggling with finding personnel to come to work, and then those that are at work maintaining a good level of vigilance.
Yes.
What would be your advice for those healthcare leaders and administrators and GI chiefs that are struggling with staffing?
I think, like we've talked about today, we have to invest in our people. So invest in their professionalism, invest in their advancement, show them that they are part of the team, whether they're in the basement reprocessing the scope or up in the infection prevention office, that everyone's part of the team, and we have to engage those groups and then help support our staff and know that they're part of the team and everyone is so integral into patient safety and the success of that unit and that team. And I think that's really important, investing in their education, professional growth, clinical ladders, and helping support them and grow them professionally.
And Dr. Othman, you made a great point today. You said that you personally meet with each of these people in the reprocessing suite. What made you decide to take that valuable time out of your clinical schedule to have that meeting with each individual?
Yeah, so you are as strong as your weakest link. And as we discussed today, that sometimes the entry point to healthcare industry, to work in the healthcare industry, is to be, as you mentioned, scheduling or washing scopes. But that job is the most important job in the unit, and that's because it's related to our patient safety. So if anything related to patient safety, I have to take it seriously. So I interview them first to make sure they are the right candidate, but also to make them understand that their job is very important, that the chief of gastroenterology in the hospital will meet you personally before you get hired for the job. During that meeting, I discussed with them recent data. I talked to them about the outbreak infection outbreak that happened in 2016. Knowing this, going into that job, make them know that they are really doing a very important job. it's very hard for you to do your task without knowing what's behind it and how important it is.
So I know you just mentioned that when we talked earlier today
Yes.
about the rationale behind the actions.
Yes.
And you said that's been one of the reasons for your success.
Yes.
How do we
Absolutely.
translate that to others across the nation and frankly across the world so that every endoscopist, nurse, technician, everybody involved in the process understands their why?
Right. I mean, I think you have to develop that educational toolkit, right, to give them that information. You can't assume that everyone who's teaching the task understands the whys and the reason behind each step or each task in whatever they're doing. So I think it's, part of the process is it's a recipe for success. So writing everything down, explaining all the processes so that, and then supporting those educators in that process so they understand why. They can reiterate that to their team that they're teaching. I think that's important, but it has to be documented, and I don't know of any documentation that is out there like that. So developing that.
And I think I can speak for all three of us. When we walk away from this event today, we walk away with renewed optimism,
Yes.
right? About
Agreed.
bringing the different stakeholders together, working with external partners like the consulate, but also the stakeholders that weren't able to be with us today, which include the FDA and the CDC because
Yes.
of travel restrictions. They play such a pivotal role in both the regulatory approval of these devices, post-market surveillance, but CDC, of course, is looking at outbreaks.
Yes.
And we've endured probably one of the worst outbreak situations that we've ever had in our professional careers. And so when we think about advancing patient safety and the things that we can do together, it's a great place of optimism. So really look forward to the outputs of this meeting. Appreciate both of you for taking the time out of your busy schedules to join us today, and appreciate the Danish Consulate for the invitation to participate today.
Absolutely. Thank you.